So for this video, we'll be talking about the second part of the clinical microscopy, which is the analysis of other body fluids. So we will be talking about cerebrospinal fluid or CSF, semen, synovial fluid, amniotic fluid, and serous fluid. So let's talk about first cerebrospinal fluid or CSF. So CSF is first recognized by Coutinho in 1764. So it is considered as the third major body fluid after blood and urine. So it is produced in the choroid plexus of the two lateral ventricles, the third and the fourth ventricle. So this is the choroid plexus in the lateral and third ventricle. Meanwhile, this is the choroid plexus present in the fourth ventricle. So this ventricular system is predominantly lined by specialized cells known as ependymal cell. So these ependymal cells produce and regulate CSF. So how do these ependymal cells produce CSF? So the choroid plexus or the ependymal cell form capillary networks that form CSF from plasma by mechanisms of selective filtration. It means that the passage of molecules between plasma to CSF is regulated. Okay, so there are substances that are present in the plasma that may not be present in the CSF. Okay, so hence the concentration of the analytes between CSF and the plasma are different. So aside from that, the choroid plexuses forming capillary networks is also termed as what we know as blood-brain barrier. So again, it protects the CSF from the components coming from the plasma. So what are the other functions of CSF? To supply nutrients to the nervous tissue, remove metabolic waste, mechanical barrier to cushion the brain, and spinal cord from trauma. So how will you collect CSF? We all know that we collect CSF by means of spinal tap, lumbar tap, or lumbar puncture. So where is the site of collection? Okay, don't forget the site of collection is the third, fourth, or fifth lumbar vertebra. Okay, huwag kakalimutan again, L3 to L5 lumbar vertebra. So the volume collected is based on the volume available on the patient, whether the patient is an adult patient or a neonate patient. Aside from that, it is also dependent on the opening pressure of the CSF. Next, after collection, the specimen is transferred into three tubes labeled as Tube 1, Tube 2, and Tube 3. So those tubes are for different sections of the laboratory. See, Tube 1 for chemistry or serology, Tube 2 for microbiology section, Tube 3 for hematology section. Okay? So we must remember again kung ano yung mga sections per tube. Okay? So how about if there are delays in the examination or test between these sections? So we must remember kung saan sila ini-store. Okay, si tube 1 stored at freezing temperature, tube 2 room temperature, tube 3 refrigerator temperature or it must be refrigerated. Okay. Usually, ang kailangan lang natin na tube is 3 tubes, but an additional tube, fourth tube, may be used. Okay, so fourth tube is actually used for microbiology. So, si microbiology yung fourth tube because at this time, kung siya yung pinakahuling na i-collect, okay, most likely, ito yung tube na wala ng contaminants from the skin. Okay, so fluid left over after each section has performed its test. So for example, there are leftover excess fluids coming from chemistry or rather for microbiology. Anong section yung pwedeng gumamit ng excess fluid na yon? So it can be used by chemistry or serological section. Okay, if there are excess fluid overall, it should not be discarded and should be frozen until there is no further use for it. Okay, so for example, si physician, isang tube lang yung na-collect niya. Okay, ibig sabihin, there is an inadequate specimen. So sa tingin nyo, ano kayang section yung dapat may priority to take that specimen? Okay, kung inadequate yung specimen. Chemistry ba, microbiology, or hematology? So the answer is actually microbiology. Okay, so don't forget the priority section if there is an inadequate specimen, that is the microbiology section. Next, we have the appearance of the CSF. So the normal appearance of the CSF is crystal clear and it must be colorless. So any discrepant results in the color of the specimen, okay, it may indicate certain condition. So I will not delve into these all appearances, but I will just emphasize yung pinaka-important. Okay, that is the bloody CSF as well as the xanthochromic CSF. Okay. Okay, next we go to the bloody CSF. So again, bloody CSF may be signified either to may be produced if there is a occurrence of traumatic tap or intracranial hemorrhage. So there is a need for you to distinguish if it is traumatic tap since this is a non-pathologic condition. Meanwhile, intracranial hemorrhage is a pathologic condition. So how will you differentiate the two conditions? Usually, it can be differentiated by means of visual examination through distribution of the blood, clot formation, or supernatant. But there are laboratories that may use microscope examination for the detection of erythrophagous hemosiderin granules or serologic test for the detection of D-dimer. So usually, ito lang yung ginagamit. Okay, so how will you differentiate the two in terms of visual examination? So for distribution of blood, in traumatic tap, there is an uneven distribution of blood, meaning yung RBC content from the tube 1 is greater than the tube 2, greater than the tube 3. So yung contents ng RBC is gradually decreasing. Meanwhile, for intracranial hemorrhage, there is an even distribution of blood among all tubes. So there is an equal RBC count among the tube 1, tube 2, and tube 3. How about for clot formation? The positive result is for the traumatic tap, meanwhile intracranial negative. So bakit kaya nag-positive si traumatic tap? Because there's an artificial introduction of fibrinogen coming from the plasma. Okay. How about for supernatant? So for traumatic tap, it has a clear supernatant. Meanwhile, intracranial hemorrhage has a xanthochromic appearance of supernatant. What do you mean by xanthochromic? So any CSF appearance, any CSF supernatant that may be either pink, yellow, or orange. So how about erythrophages? So erythrophages or neutrophil ingested RBCs, hemosiderin granules, positive sino? Si intracranial hemorrhage. Okay, take note, positive si intracranial hemorrhage. How about for D-dimer? So again, we try to recall, D-dimer is a specific test for DIC. So it indicates fibrinolytic or bleeding episode. So sino ba dito yung may bleeding or pwede magkaroon ng fibrinolytic episode? Okay, of course, it's intracranial hemorrhage. That's why positive sino? Si intracranial hemorrhage. Okay, we now go back. So another appearance to take note of is the xanthochromic appearance. Again, xanthochromia is a term used to describe CSF supernatant that is either pink, orange, or yellow. So the most common cause of xanthochromia is due to the presence of RBC degradation product. That's why the presence of xanthochromia is only present at intracranial hemorrhage, not on traumatic tap, since in intracranial hemorrhage, there are presence of RBC degradation products. So the variation between the color is dependent on whether there is dependent on the amount of RBCs present in the specimen. For example, there is a pink coloration. So the pink color indicates that it has a very slight amount of oxyhemoglobin. For orange, it has heavy hemolysis. Yellow for conversion of the hemoglobin to unconjugated bilirubin. Next appearance to take note of is the pellicle formation. Why is it important to take note of si pellicle? Because the pellicle formation indicates condition tubercular meningitis. Okay, so how will you demonstrate the pellicle clot formation? So it can be seen at overnight refrigeration. Okay, so ano bang appearance nito ni pellicle clot? Okay, ito yung appearance ni pellicle clot. Okay, so again, huwag kakalimutan na yung tubercular meningitis natin can only be seen after overnight refrigeration. Next, we have the CSF cellular count. So the most routinely performed cell count for CSF is the WBC count. CRBC is seldomly requested because it is only done if there are cases of traumatic tap or correction for leukocytes or protein. Again, I've mentioned earlier that there is a need to differentiate traumatic tap intracranial hemorrhage. So one way is to observe the distribution of blood. So one way you can observe the distribution of blood is to perform RBC count. Okay. So cell count should be done immediately because there is a tendency for the WBCs as well as RBCs to lyse after 1 hour. So normally, ang adult natin contains 0 to 5 WBCs per UL. So usually, of course, children, mas mataas yung WBC. Up to it may be even up to 30 mononuclear cells per UL. So still, kahit 30 mononuclear cells na siya, it is still considered as a normal count. So how will you perform cell count for CSF? Actually, lahat ng cell counting natin, isa lang yung formula. It can either be for sperm count or sperm concentration, pwedeng WBC, platelet count sa hima, sa WBC count sa hima, RBC count sa hima. So pare-pareho lang ng formula yon. So yung general formula natin for cell count is the number of cells counted multiplied to the dilution factor. Dilution factor is the reciprocal of the dilution over areas counted multiplied by depth. So yung depth natin, constant na yan as 0.1 millimeter. So the dilution factor or dilution for CSF depends on the clarity of the specimen. Meanwhile, yung areas counted depends on how many ruled areas or chamber you are counting. Usually for CSF, WBC as well as CSF total cell count, ang areas na binibilangan natin is yung four corner squares and the center square. Okay, huwag kakalimutan. Four corner squares and center square. How about for the RBC count? If, for example, my cases of traumatic tap. Okay, so you will count RBCs on the central square, specifically yung apat na corner, tapos yung nasa gitna na center square. Okay, so just like yung counting natin for RBC in the blood. So I've said again, dilution factor depends on the clarity of the specimen. So if there, you need to observe the clarity, and from that, malalaman mo kung anong gagamitin mong dilution. For clear, undiluted, for slightly hazy, you have 1:10, hazy, 1:20, slightly cloudy, 1:100, cloudy, slightly bloody, 1:200, turbid to bloody, 1:10,000. Okay, so although there is no need for you to memorize this, but it also helps because some of the problems may not indicate yung dilution natin. So, saan ka magbe-base? Of course, dun sa clarity na specimen na ibibigay. Okay? So, the total cell count, the diluting fluid for total cell count is normal saline. For WBC count, 3% acetic acid with methylene blue. Usually naman, kahit sa WBC count natin for hematology, ang ginagamit na diluting fluid for WBC is acetic acid. Okay? Because acetic acid is a hypotonic fluid, which causes, of course, the RBC to lyse and the WBCs to remain. So may addition ng methylene blue in order to visualize better the WBC nuclei. So again, RBC count not usually done. If you need RBC, the amount of RBCs, you just need to subtract the total cell count with WBC count. Next, after total cell counting, now move on to the differential count on CSF. So it is performed on a stain smear to consider the abnormal cells with considerable diagnostic importance. So prior to examination, there should be a maximum number of cells available. So lagi naman natin yan ginagawa before differential counting. So there must be a concentration method used to obtain the maximum number of cells. So usually, ang ginagamit naman natin in the laboratory is of course centrifugation. Okay, centrifugation. So, I just want to emphasize centrifugation because usually ito na yung ginagamit sa ng laboratories in the United States of America. So, in here, cytocentrifugation, may production na adequate cell yield with less cellular distortion. So, yung cells dito in cytocentrifugation are contained in a monolayer within 6 mm diameter. Okay, so ang keyword dito for cytocentrifugation is that may production ng monolayer of cells in order to prevent yung overlapping ng mga cells natin. So just like in hematology, you need to count at least 100 cells. So the normal constituents for CSF is the lymphocytes and the monocytes. So the normal cells in CSF, again, lymphocytes and monocytes. Although take note that occasional neutrophils may also be seen in normal CSF. So the increase in lymphocytes or monocytes or the normal cells is termed as pleocytosis. Okay, although pleocytosis is considered as increase in normal cell, pleocytosis is considered as abnormal. So bakit kaya abnormal si pleocytosis? So again, si lymphocytes and monocytes may increase in certain conditions. So ano ba yung mga condition na yun? Pwedeng viral condition, viral infection, tubercular infection, pwedeng fungal infection. Okay, and those conditions are of course pathologic conditions. So next, we have yung mga description as well as appearance of the cells in CSF. Of course, neutrophil, primarily seen in bacterial meningitis. Aside from that, is also present in early or acute phases of viral, tubercular, fungal, and parasitic meningitis. So usually, pag naisip natin neutrophil, present yan sa bacterial meningitis. But Take note that is also present in earlier acute phases of viral, tubercular, fungal, and parasitic. So wag kakalimutan, pag nabanggit sa tanong, anong WBC yung umaakyat in early or acute viral infection. So it's not actually lymphocyte, but the WBC is increased in acute viral infection is neutrophil. So again, increased to in early cases or acute cases of viral, tubercular, fungal, parasitic meningitis. So aside from that, neutrophil can also be seen during repeated spinal taps, hemorrhage, so again, neutrophil-ingested RBCs or erythrophage, as well as injection of medications or radiographic dyes. Next, we have yung lymphocyte and monocyte. Take note again, lymphocyte and monocyte, they are considered as the normal cells of CSF. Okay, so it is common in cases of viral, tubercular, and fungal meningitis, as I've said earlier. Okay, so lymphocytosis again, viral infection. So lymphocytosis coupled with plasma cells may indicate multiple sclerosis. So again, multiple sclerosis is a plasma cell disorder. Okay, plasma cell disorder. Next, we have eosinophil. So eosinophil is associated with parasitic infection, most commonly infections with rat lungworm. Okay, if you try to recall, rat lungworm is also known as Parastrongylus cantonensis. So Parastrongylus cantonensis is the most common cause of eosinophilic meningitis. Okay, aside from parasitic infection, is also increased on fungal infection with Coccidioides immitis. So again, Coccidioides immitis is a fungi that causes San Joaquin Valley fever or desert fever. So aside from that, eosinophil may also be increased when introduced with foreign material medication, including shunts or medications into the central nervous system. Next, we have macrophages. So macrophages are usually seen following repeated taps, okay, as well as if the patient may previous hemorrhage. But the only difference is that if the macrophages is present because of a previous hemorrhage, macrophage may have certain inclusions in their cytoplasm. So, okay, ano yung mga inclusions na yon? So, it can either be hemosiderin inclusion, hemosiderin granules, or hematoidin granules, both of which present yan because of previous hemorrhage or hemorrhagic condition. So, ang basic difference lang nitong dalawa, si hemosiderin and hematoidin, is that si hemosiderin contains iron, meanwhile si hematoidin non-iron containing degradation form of hemoglobin. Okay, again, wag kakalimutan, hemosiderin contains iron, meanwhile si hematoidin non-iron containing. Okay, next. Next, we have yung non-pathologically significant cells. Okay, so non-pathologically meaning they are non-malignant in nature. So kung non-malignant sila or non-pathologic sila, why are they considered as significant? Okay, because these cells may resemble malignant cells. So bakit nila nire-resemble ang malignant cell? Because usually the appearance of these non-pathologically significant cells are in clusters. So usually kasi ang mga malignant cells, they usually form in clusters. So magkamukha sila. So it is important to take note the presence of these doesn't indicate malignant condition. They may indicate that si patient nag-undergo ng certain diagnostic procedures such as pneumoencephalography and ventricular tap. Okay, so those cells, these non-pathologically significant cells include ependymal cell, yung nabanggit natin kanina, lining yan ng choroid plexus, nagproproduce ng CSF, as well as choroidal cell, naglaline din yan sa choroid plexus but it doesn't produce CSF, and as well as the spindle-shaped cell. So this is the appearance of choroidal cell. Again, lining of the choroid plexus. This is the ependymal cell, lining of the ventricles and neural canal. Again, it produces as well as regulate CSF. So this is the spindle-shaped cell. Notice yung spindle shape, yung pagiging spindle shape niya, yung pagiging tapered yung ends niya. So these represent the lining cells from the arachnoid. Next, we have yung mga malignant cells natin. So malignant cells of hematologic origin. So important to, but it is important to because this signify that si patient may serious complication na ng acute leukemia. Okay, sabihin yung present ito sa CSF, ibig sabihin, nagkaroon na ng metastasis yung leukemia ni patient. So, kasama dyan si monoblast, lymphoblast, okay, myeloblast, Okay, next we have yung malignant cells non-hematologic origin. Ito naman, hindi naman ito nag-arise from serious complication of acute leukemia, but it arises from neurologic condition, malignant neurologic condition. So it can either arise from medulloblastoma, retinoblastoma, okay, as well as astrocytoma. Kung na-notice natin, kung makikita natin, again, di ba they usually occur in cluster. Okay, ito nga actually, itong si retinoblastoma may resemble yung kaninang cell natin, si ependymal cell. Because kung makikita, medyo pabilig yung nucleus, tapos they often occur in clusters. Okay, so again, they are important to take note of. Okay, yung pagkakaiba-iba nila. Next, we have yung CSF chemistry test. So the usual chemical constituents of CSF includes protein, glucose, lactate, and glutamine. So isa-isahin natin ito. So protein is considered as the most frequently performed chemical test on CSF. So the CSF contains small amount of protein at least 15 to 45 milligram per deciliter. So sobrang baba niya. Okay? When compared with the total serum protein, okay, mas 100 times yung value ng total serum protein natin as compared with CSF protein. Okay? Dito kasi sa CSF protein, 15 to 45 milligram per deciliter. Meanwhile, yung sa serum protein natin, about 6.5 to 8 gram per deciliter. Okay? When compared, pag kinumpare mo sila, abot siya ng 100 times. Mas malaki yung serum protein natin. Okay. In general, the CSF contains protein fractions similar to those found in serum. So kahit yung component ng CSF protein mas konti, yung fractions nila still similar pa din. So ano na ba yung mga fractions present in the CSF? So still, a major protein found in CSF is the albumin, same with the serum, but the second most prevalent fraction here in CSF is the prealbumin or the transthyretin. So when compared with the serum, si prealbumin, meron din si prealbumin sa serum, but si prealbumin, mas konti siya as compared with the CSF. Okay, kasi yung second most prevalent fraction sa serum na protein is, of course, yung alpha-1 globulins natin. Okay, so CSF, the second most prevalent fraction is prealbumin. So next, we have yung alpha-globulin containing haptoglobin ceruloplasmin, beta-globulin containing transferrin, which is the major beta-globulin. So, emphasize ko lang to si carbohydrate deficient tau transferrin fraction. So, this tau transferrin, ito yung fraction meron lang si CSF na wala si serum. So for example, if you want to identify a known fluid if it is a CSF, okay, check for the presence of carbohydrate deficient tau transferrin fraction. Okay, because this protein is only present in the CSF and it's not present on other parts of the body. So for gamma globulin, usually ang laman lang ng CSF is IgG and IgA. So ano yung mga proteins na hindi nakaka-pass through from plasma to the CSF dahil nga nandyan si blood-brain barrier? Usually, wala dapat IgM, fibrinogen, and beta-lipoprotein. Okay, remember these three. So IgM, fibrinogen, and beta-lipoprotein, they are not found in normal CSF, of course, because of the presence of blood-brain barrier. So here are the conditions associated with the decreased or elevated results of CSF protein. Okay, so yung diagnostic significance or clinical significance ng CSF protein is actually in the elevated portion. Why? Because in this elevated portion, nandito lahat yung mga pathologic condition. Okay, meanwhile, for decreased result, okay, usually walang mga non-pathologic naman. Okay, for elevated result, nandyan sila meningitis, hemorrhage, tumor, multiple sclerosis. Okay, so yung pathologic or yung clinical significance natin arises from the elevated results of CSF protein. So how will you perform CSF total protein in the laboratory? So by means of turbidimetric method as well as dye binding method. Turbidimetric method, you can use either trichloroacetic acid or sulfosalicylic acid. So the reagent of choice for CSF total protein is yung TCA natin because it precipitates both albumin and globulin. Okay, for SSA naman, sa SSA, although it detects both albumin and globulin, mas naglilin towards siya with albumin. So in order for you to detect equally both portions of albumin and globulin, you should add sodium sulfate. Okay, so Next, we have yung dye binding method. So, dye binding uses, of course, dye. Yung ano yung dye natin usually ginagamit. Pwedeng Kumasi Brilliant Blue dye or Ponshu S dye. So, si CBB, of course, produces blue color. Ponshu S produces pinkish red color. Next, we have yung CSF serum albumin index. So, why is there a need to perform CSF serum albumin index? Na-mention natin na usually ang protein ng CSF mababa dapat as compared with serum. So, in cases na may elevated protein, there is a need for you to evaluate kung may problem ba yung blood-brain barrier kaya tumaas yung protein or baka naman may production ng protein within the CNS itself. Okay? So, CSF serum albumin index evaluates the integrity of the blood-brain barrier. So, may formula dyan, CSF albumin over serum albumin. So, the normal result is that dapat yung result less than 9. So, less than 9 indicates an intact blood-brain barrier. So, the elevation of protein may be due to the production of protein within the CNS itself. Okay? So, the increase in value is proportional to the amount of damage in the barrier. How about si serum IgG index? Again, kung wala namang defect yon si protein, wala namang defect si blood-brain barrier, baka naman may production ng protein or IgG within the CNS. So how will you perform CSF serum IgG index? So CSF IgG over serum IgG over the CSF albumin index. Okay, so a normal value naman dito, less than 0.7. Okay, pag greater than 0.7 na yon, indicates production of IgG within the CNS. So ano ba yung mga condition associated with production of IgG or antibodies with CNS? So again, yung most common na dapat nating alam, of course, si multiple sclerosis. Next, we have the CSF protein fractions methodology. So as I've said earlier, yung mga normal protein fractions ng CSF, similar siya with the protein fractions sa serum. So usually, the diagnosis of neurologic disorder is based after performing CSF protein fraction, not on the CSF total protein. Okay, dito natin madedetect kung ano yung mga protein fractions na wala, na meron, at kung ano yung increase. So the most common performed CSF protein fraction is by, of course, electrophoresis. So the primary purpose for performing CSF protein electrophoresis is to detect oligoclonal bands. Okay, before performing CSF protein, you must make sure that gumagawa ka rin ng serum electrophoresis to ensure that yung oligoclonal bands or increased bands natin, increased proteins natin are present as a result of neurologic inflammation, not systemic condition. So, oligoclonal bands seen in CSF and serum indicate systemic conditions. Okay? Ano yung mga systemic conditions na yon? Pwedeng may leukemia talaga si patient, kaya tumaas yung CSF protein, pwedeng may lymphoma, or pwedeng may HIV-C patient. Okay? So, of course, that includes multiple myeloma, okay, oligoclonal bands seen both in CSF and serum. How about if the oligoclonal bands are seen in CSF only? Okay, so it may indicate conditions like multiple sclerosis, neurosyphilis, Guillain-Barré syndrome, and encephalitis. So usually pa nga, multiple sclerosis may indicate 2 or more oligoclonal bands. Kanina pa natin ito na-mention, ito si multiple sclerosis. Ano ba itong si multiple sclerosis? So, multiple sclerosis is an autoimmune disorder wherein there's a production of anti-myelin sheath antibody. So, multiple sclerosis is a demyelinating disease. Okay, since may anti-myelin sheath antibody, may consequent destruction ng myelin sheath sa central nervous system. So, what are the other methods being used for separating protein fractions? It can either be through CSF immunofixation electrophoresis, CSF isoelectric focusing followed by silver staining. So basically for immunofixation, you will use anti-sera to separate the components. How about for isoelectric? Okay, you'll use the isoelectric point naman. Okay, so CSF isoelectric point or focusing followed by silver staining is a more sensitive method as compared with the other two. Next, we have CSF glucose. Again, CSF glucose is one of the chemicals that are limited or regulated when being transported to the CSF. So the glucose enters the CSF by selective transport across the blood-brain barrier. So CSF glucose usually mas mababa yung amount niya as compared with the plasma glucose. So usually it is 60 to 70%, average of 65 to that of the plasma glucose. Take note again, 65% lang of the plasma glucose. For example, may 100 milligram per deciliter na glucose si patient. So, ibig sabihin, 65% of that, yun naman yung amount ni CSF glucose. So, 65 milligram per deciliter yung amount na CSF glucose ni patient. So, lower than that, it may indicate certain condition. Okay? So, for an accurate evaluation of CSF glucose, a consequent or simultaneous blood glucose test must be run for comparison. So, kanina na-mention natin sa protein, the diagnostic or clinical significance is placed at the elevated result. Okay, baliktad naman siya for CSF glucose. Okay, yung clinical significance naman niya is placed at the decreased CSF glucose. Okay, so decreased CSF glucose, pathologic conditions, nandun siya. Okay, pag elevated, it is always a result of plasma elevation. Okay, so ano ba yung main purpose ni CSF glucose natin? So again, ang pathologic condition is on the decreased portion. So kung mapapansin nyo, usually yung mga decreased, okay, yun nandito. Okay, so how will you differentiate the cause of the decreased CSF glucose? Okay, if there is markedly decreased CSF glucose with high WBC, specifically in presence of neutrophil, of course, neutrophil, it may indicate bacterial meningitis. How about for decreased CSF glucose with high WBC, specifically in lymphocytes natin or monocyte? Okay, it can either be tubercular, fungal. Okay, tubercular or fungal. How about if normal yung CSF glucose with high WBC, lymphocytes yung predominant? Okay, it indicates viral meningitis. So take note again, the effect of viral meningitis at CSF glucose is normal. Okay, walang effect si virus sa CSF glucose. Normal lang siya. Next, for CSF lactate. So again, lactate or lactic acid is associated with glucose metabolism. So ang relationship ni lactate with glucose is actually inversely proportional. So if there is decreased CSF glucose, there is a consequent increased CSF lactate, since lactate is produced after glucose metabolism. So it is more reliable than glucose in diagnosing or classifying meningitis because the effect of the causative agent on CSF lactate occurs much more than the effect of those conditions or in the glucose. Okay? So usually mas unang nag-iiba yung value ni lactate as compared with glucose. Okay, so again, the highest elevation of lactate is of course yung pinakamababang CSF glucose kanina, which is the bacterial meningitis. How about for tubercular and fungal meningitis? So, increased then, but not as comparable with bacterial meningitis. How about for viral meningitis? Okay. Of course, again, viral meningitis, normal yung CSF glucose. Kung normal CSF glucose, anong effect ng CSF lactate? Okay, normal din. Okay, so for viral meningitis, the CSF lactate is normal or less than 25 milligram per deciliter. Next, for xanthochromic or hemolyzed fluid, take note that it may produce elevated CSF lactate. So why? So again, RBCs contain lactic acid. Okay. Saan galing yung lactic acid? Of course, again, RBCs also metabolize glucose. Next, we have CSF glutamine. CSF glutamine is produced from ammonia and alpha-ketoglutarate by the brain cells. So usually, glutamine is the deactivated form of ammonia. Okay, so CSF glutamine is associated with liver disorders. So specifically, yung tinatawag nating mga liver disorders na yun, usually cirrhosis, okay, Ray's syndrome, hepatic encephalopathy. So those conditions that may cause elevated ammonia. So if elevated yung ammonia will travel to the central nervous system, be deactivated by the brain cells, and form CSF glutamine. So CSF glutamine is frequently requested again for patients with coma of unknown origin or children with Ray's syndrome. Again, na-mention natin si Ray's syndrome. So Ray's syndrome is acute encephalopathy or acute hepatic encephalopathy and liver infiltration seen in children after aspirin use following viral infection. So again, Ray's syndrome associated with use of aspirin as well as viral infection. Again, wag kakalimutan, si Ray's syndrome associated with aspirin usage and aspirin usage following viral infection. Next, we have yung myelin basic protein natin. Myelin basic protein indicates recent destruction of myelin sheath. So again, It is used to monitor the course and effectiveness of treatments for multiple sclerosis. 4, it is actually used as a monitoring for multiple sclerosis. Again, I've mentioned earlier, multiple sclerosis is an autoimmune disease characterized by the presence of autoimmune autoantibodies towards myelin sheath. So if there is a destruction of myelin sheath, of course, pwede mong ma-measure yon to monitor yung effects ng multiple sclerosis. Next, we have yung CSF microbiology test. So it is performed mainly to classify the cause of meningitis, whether bacterial, fungal, viral. Okay, so the usual tests to be performed in CSF are gram stain, acid fast stain, India ink preparation, latex agglutination test. So ito mga organisms, okay, di na masyado important yan. So we move now to, of course, yung mga tests. Okay, India ink preparation again for diagnosis of Cryptococcus neoformans. Okay, in the ink, again, is a negative stain. Nasa-stain niya yung background. So, ang makikita natin in the slide is actually the encapsulated Cryptococcus neoformans. Okay? Next, we have yung gram stain naman ni Cryptococcus neoformans. So, this gram stain of Cryptococcus neoformans is characterized as having appearance of starburst pattern. Okay? Again, kung maalala, the appearance of Cryptococcus neoformans on gram stain is characterized as starburst appearance. Next, this is a gram stain naman of parasitic infection with Naegleria fowleri, diba, which causes primary amoebic meningoencephalitis. Next, we have yung right gym stain naman, again, yung Naegleria fowleri. Next, we have yung latex agglutination test. Okay, so it is used to detect cryptococcal antigen. So detect the presence of Cryptococcus neoformans antigen in serum and CSF. So mas sensitive tong method na to than the in the ink preparation. Although it is more sensitive, it is susceptible to false positive result. Okay, due to presence of rheumatoid factor. So how will you inactivate the false positive results due to rheumatoid factor? You can either treat the specimen, CSF or serum with diethyltritol, pronase, or EDTA. Okay, or you can heat the specimen at 56 degrees Celsius. So remember, kung ano yung resolution natin para ma-eliminate yung interference with rheumatoid factor. So you can either treat the specimen with diethyltritol, pronase, or EDTA. Next, last natin, we have yung CSF serology tests. So CSF serology is basically for the detection of presence of neurosyphilis. Again, neurosyphilis is in what stage of syphilis infection? Again, neurosyphilis is in the tertiary stage of syphilis. Yung pinakamalalang stage na ng syphilis. So usually, hindi na to ginagawa kasi may treatment naman tayo for CSF na iiwasan na yung formation ng neurosyphilis. Okay, ano ba yung treatment natin for syphilis? Yung pinakasimpleng antibiotic natin, okay, which is penicillin G, okay, or Pen-G. So the recommendation of CDC for neurosyphilis is the VDRL, the Venereal Disease Research Laboratory Test. Okay? So take note again, ang recommended lang for detection of neurosyphilis or for CSF is VDRL. Huwag kakalimutan. So, for example, tinanong kayo, okay, nag-reactive daw yung RPR sa CSF. Okay, how will you report the result? Okay, the answer is actually, the result is unreportable. Okay, the reason is, of course, hindi recommended na gawan ng RPR sa CSF because it is susceptible to false negative results. Okay, it is susceptible to false negative results. Si RPR when done in CSF. So, after CSF, magkakaroon tayo ng slight recalls, yung mga napag-aralan natin, okay, mga katapos na ideas. So, some of these questions come from different references. Okay, so try to answer them. Okay, so the first question, the lab received CSF tubes labeled as tube 1, 2, and 3 from a patient with subarachnoid hemorrhage. So, hemorrhage. Which of the following is likely? Okay, so which of the following choices is associated with subarachnoid hemorrhage or hemorrhage? A. Homogeneous distribution of RBC among all tubes. B. High RBC in the first tube, gradually decreasing in the succeeding tubes. C. Presence of clots in the tubes. D. Colorless supernatant after tube 1 centrifugation. What is the answer? The answer is actually A. Homogeneous distribution RBC among all tubes. So again, if you try to recall, the hemorrhage, if if there is an intracranial hemorrhage, there should be an equal distribution of RBCs among tube 1, tube 2, and tube 3. So tube letters B, C, D rather refers to traumatic tap. So again, in traumatic tap, there is an uneven distribution. Mataas yung RBC in the first tube, pababa na paba up to the third tube. How about for letter C? So the presence of clots, of course, in the traumatic tap. So again, artificial introduction of fibrinogen coming from the plasma. How about the letter D? There's a presence of colorless supernatant after tube 1 centrifugation. So again, colorless supernatant in traumatic tap and then xanthochromic supernatant naman for traumatic or rather intracranial hemorrhage. Next, a patient was subjected to pneumoencephalography. So after CSF microscopic examination, the medical laboratory scientists noticed the following cells. Which is most likely? So the answer is actually letter D. The patient is normal. So again, bakit normal si patient? So again, the cells seen by the medical laboratory scientists is actually choroidal cell. So again, choroidal cells are non-pathologically significant cells which may be seen after certain diagnostic procedures such as pneumoencephalography. Okay, take note again, pneumoencephalography and ventricular tap. So yun yung mga procedures na pwede mag-manifest ang choroidal cell. Okay, so this is a picture of choroidal cell. Increase in CSF lactate is found in? Okay, the answer is actually letter A. So bacterial meningitis. Kung maaalala, bacterial meningitis causes markedly decreased CSF glucose. And again, if there is a markedly decreased CSF glucose, there is a consequent increase naman in CSF lactate. So usually si B, C, at D, wala namang kinalaman yan sa CSF lactate. Next, which CSF results is consistent with bacterial meningitis? So again, ang result natin, basic result natin for bacterial meningitis, okay, we have markedly decreased CSF glucose. Okay, again, if may markedly decreased CSF glucose, mataas naman yung lactate. Again, ano ang mga RBCs or mga WBCs na makikita mo for bacterial meningitis? We have neutrophils, okay, predominantly neutrophils natin, di ba? Okay, so saan kaya dito yung tamang sagot? A, B, C, or letter D? Actually, pwede ka na mag-eliminate ng mga wrong answers. So we know that in bacterial meningitis, there is increased in CSF lactate. So it's either letter A or B yung tamang sagot. Okay, so how will you eliminate the wrong answer? So again, in bacterial meningitis, there is a markedly decreased glucose. Okay, so markedly decreased glucose, of course, yung mababa. Okay, so the correct answer is letter A. Next, a slightly hazy CSF specimen was submitted to the laboratory for cell count. The medical laboratory scientists counted 151 and 167 cells in 5 RBC squares on both sides of the hemocytometer. What is the total RBC count? So again, we must take note yung formula. Okay? So again, ano yung formula natin for counting? So the general formula again is cell count multiplied by dilution factor over area multiplied by depth. Again, yung depth natin is 0.1. Diba? Constant na yon. So again, i-formula natin cell count multiplied by dilution factor over area and depth. Okay, so paano natin, anong gagawin natin kung dalawa yung given na cells? Cell counting. Again, average lang natin yan. So add and then divide by 2. So how about the dilution factor? So again, dilution factor depends on the clarity of the specimen. So slightly hazy specimen, ibig sabihin, ano yung dilution yan? If you try to recall, ang dilution natin for slightly hazy is 1:10 dilution. Okay? So usually naman binibigay yan sa examination. Okay, usually binibigay yan sa examination. But just in case lang, okay, it's much better to, of course, memorize. Okay, so the dilution factor now is, again, the reciprocal of 1:10. Of course, that is 10. How about for the area? So in here, hindi given yung area counted. Okay, 5 RBC squares on both sides of the hemocytometer. Walang binigay na area but sinabi lang na kinount daw sa 5 RBC squares. So huwag kakalimutan, pag nabanggit, pag kinount daw sa 5 RBC squares, it is equivalent to what area? 1 over 5 or 0.2 square millimeter area. Okay, again, magkakalimutan, 1 over 5 or 0.2 square millimeter area. So what is the depth again? 0.1. Okay, so answer lang natin. So the CSFWBC count is 159 times 10 over 0.02. The answer is 79,500 CSFWBC. My correction, CSF RBCs. Okay, RBCs. So the answer is letter B. Again, this is very important because tinatanong to sa ASCP examination natin. Next, the finding of hemosiderin-laden macrophage in CSF sample indicates, so again, macrophage is usually present on frequent spinal taps, but if it has inclusion, specifically kung may hemosiderin inclusion or hematoidin inclusion, it indicates what? Previous hemorrhage. Okay, so again, hemosiderin inclusion as well as hematoidin inclusion indicates previous hemorrhage.